Hi everyone, let's talk about the factors affecting mortality rates. So mortality rates can be in the form of death rates, but also how high your life expectancy is and also your infant mortality rates. So here are the factors which can affect increasing or decreasing mortality rates. Demographic-wise, you have degenerative diseases. So as you age, as you get older, you will have an increased chance of getting diseases such as heart disease or stroke, or maybe higher chances of cancer. And this it kills your elderly population. So you're always going to have this background death rate of your elderly. As for social and cultural factors, first thing is lifestyles. If you have unhealthy lifestyles, maybe you have bad diets, or if you drink alcohol, you smoke tobacco, you lack exercise, you get issues with the kidneys, issues with diabetes, issues with lung cancer, and adds to your mortality rate. Unprotected sex-wise, you can get exposed to STIs, maybe HIV and AIDS. Social classes-wise, if you have this large inequality, maybe the wealthy, you will get access to food and healthcare, but majority of the poor, which is what occurs in social classes, you have a lot of the working classes, the poor classes, they don't have the adequate access to healthcare to better their health or get routine checkups. Food as well, they might have food insecurity, and also work. Generally, they will work the tiring and laboring and dangerous jobs, whereas the wealthier, they'll work maybe sitting in parliament or something. Work leads to injuries as well. Maybe you're working with machinery, working with agricultural machinery and stuff that leads to injuries, which may cause deaths. Accidents such as car accidents, driving incidents, and also crime rates. Maybe you have rebelliousness from the youth, or cartels, or just murder in general. You can increase your mortality rates. Mental health issues, especially in developed countries, the stress from education, just social expectations, and also work can lead to higher suicide rates, which adds to mortality rates. Poor living conditions wise, you have damp environments which may breed mosquitoes and give you dengue fever, malaria. Overcrowded can spread diseases like tuberculosis. Lack of sanitation, maybe your water pipes are kind of linked together with your sewage disposal. You get cholera. Sorry, you get cholera in that case. So let's move on to economic factors. With economic factors, you get poor healthcare. If your country is not developed enough, they don't have money to fund healthcare. Maybe public healthcare is not funded. So you have inadequate access to resources such as vaccines, medicines, and also your facilities. They don't have space for the capacity for everyone. So you have long queues, long lines, and in the waiting time, some people may die. As for poverty, again, this links to your social classes issue with lack of access to healthcare, food, and you have to work tiring jobs. Food insecurity and malnutrition. So you lack energy, you maybe starve to death, which adds to your death rates. Environmental issues wise, natural disasters, they can directly cause deaths, maybe through flood drowning people. They can also breed mosquitoes, especially floods and hurricanes and stuff. They also affect food. Maybe a tsunami wipes out your harvest and stuff, and that leads to food insecurity problems. Similar to poor harvest, that also adds to food insecurity, which leads to more deaths. Also, political issues with war. War can occur, and you have casualties during a war, so you have deaths. Also, government policies. This is maybe for more authoritarian regimes, such as Nazi Germany or the Soviet Union, where they genocide populations, increasing the mortality rates. So this sums it up for the factors affecting mortality rates. I hope you guys enjoyed it, and I'll see you in the next video.